Tropical Storm Karen has weakened, and now back to Flora. Thank you, Jill. I have with me today Ruby Ball, who is a registered dietitian at Southeastern Medical Center. She is going to talk to us today about cirrhosis. Thank you for coming to speak with us today, Mrs. Ball. Thank you, Flora. Cirrhosis is a hepatobiliary disease. What is a hepatobiliary disease? A hepatobiliary disease is a disease of the liver, pancreas, or gallbladder. Cirrhosis occurs when healthy tissue in the liver is replaced by scar tissue. The scar tissue blocks the blood flow, and the liver doesn't function properly. How do you get cirrhosis? Causes of cirrhosis are hepatitis C, alcohol abuse, hepatitis B, non-alcoholic fatty liver disease, some hereditary diseases, and bile duct disorders. How does nutrition help patients with cirrhosis? Nutrition therapy can ease complications such as encephalopathy and portal hypertension. Patients with cirrhosis need 35 to 40 kilocalories per kilogram of body weight per day. They also need up to 1.6 grams of protein per kilogram of body weight per day. Since diabetes is common in patients with cirrhosis, carbohydrates should be spread throughout the day. Patients with ascites should consume no more than 2 grams of sodium per day. Coma patients who do not respond to normal treatment should be given an enteral product that is high in branched-chain amino acids. Patients with steatorrhea should have fat restricted to less than 30% of their daily calories. Patients with severe encephalopathy should have their protein restricted. Patients with mild encephalopathy should have vegetable and dairy-based proteins because these proteins are lower in aromatic amino acids. Supani Pudadekkum and others from ISRN Gastroenterology conducted a study in Thailand on nutritional assessment in patients with cirrhosis. Pudadekkum and associates said that patients with cirrhosis are often malnourished due to poor food intake, malabsorption, increased intestinal loss, decreased protein synthesis, disturbances in substrate utilization, and hypermetabolism. They also state that vegetative protein containing branched-chain amino acid supplementation has been proven to be an effective treatment in patients with cirrhosis. The article Nutritional Status Assessment in Cirrhotic Patients After Protein Supplementation explains the research. The researchers gathered 22 people, 12 male and 10 female, who were diagnosed with cirrhosis. In the cross-sectional prospective clinical trial, each patient received 20 grams of soy supplementation on a daily basis for 8 weeks. The researchers used anthropometric measures, bioelectrical impedance, visceral protein, and subjective global assessment to determine nutritional status of the patients. Their level of severity was measured using subjective global assessment and using assigning Child-Pugh scores. A Class A score indicated a normal nutritional status, Class B was suspected or moderate malnutrition, and Class C was severe malnutrition. The patient's oral intake was measured using 3-day dietary recalls at 4 and 8 weeks. After the 8-week intervention, the number of patients in Class C decreased from 1 to 10. Class B had a decrease from 11 to 4, and Class A had an increase from 10 to 18. According to the Child-Pugh scores, the vegetative protein supplementation improved the nutritional status in most patients. Anthropometric measures, bioelectrical impedance, and visceral protein did not show as much of an improvement. The researchers concluded that subjective global assessment is a significant way to measure the nutrition of patients with cirrhosis. Well, that's all we have time for today. Thank you, Ms. Ball, for teaching us about cirrhosis. Thank you for inviting me to speak with you today. Now, back to Jill for an update on Tropical Storm Karen